cases popped up only occasionally early on in all of this, but since late September through today, the coronavirus really took hold. Now, the man heading up that health district is Public Health Officer Braden Bradford, and Braden is with us via Zoom. So glad you are with us, Braden. It's important work that you're doing out there. First of all, I want to get a sense of what you're looking at. What is the challenge on the ground there right now?
So one of the challenges in our area is just access to healthcare, and included in that is access to testing. We have been navigating as well public opinion. As you mentioned, we had very few cases early on, and that really kind of set an idea that we would be exempt from the effects of COVID for a long time. And so it's only been recently, last couple of weeks, I feel like locally, as a communities, we've realized that it's here, it's not going away, and we need to embrace the public health measures that are recommended.
Yeah, you know, one thing, I was traveling in that area. Those are three just gorgeous counties. I love going camping, and I was in Emery County just this summer. And I honestly, I felt like a little bit of a fish out of water when I went into a store with a mask on in the summer. You know, you just kind of get the sense that because it hit so late, you have a challenge. How do you talk to people about it, and do you get pushback?
I think all public health gets a little bit of pushback, but it's really decreased again in recent weeks. But once the statewide mask mandate was put in place, it did still take probably 2 weeks before the businesses and patrons of the businesses began to embrace that. Mm-hmm. And seeing the numbers as they expanded, and one of the, I guess, benefits in some way of a small community is that you generally know the people that may end up in the hospital, and that's a profound that has a profound effect on behaviors, is when your neighbor ends up there.
And our viewers are seeing a map with your three counties and the test positivity in those counties. And the reason that I was focusing in on Emery is really because of this number. Emery has 11,000 and some residents, and 37% of the people who get tested are coming back positive. And so, I mean, that tells you that there are a lot more cases out there than we even know about, doesn't it?
Yes, it does. And one challenge in Emery County in particular has just been access to testing. They have a clinic out there that's done a great job, but it's a small clinic. We've recently been able to implement some testing through the health department, and then we know extracurricular activities at the schools. But because testing has been limited, it's really been only individuals that are kind of on that the downhill slope health-wise. They've got multiple symptoms, and so we haven't been able to do kind of the more widespread contact testing and asymptomatic testing that we would love to do. But that certainly leads to not only, you know, the 37% we've seen this week, it's been over 30 a number of times in the past 2 months.
And there's been a higher death rate among the cases that you do find down there. I wonder, is there an older population? Are there health problems specific to the population in rural Utah or in these areas specifically?
We've always focused on some of the effects that kind of long-term minors have on their respiratory system. Our area does have a little bit of higher smoking rate than the rest of Utah. It's not that high, but that's something that has, we know impacts the respiratory system and long-term health. But generally speaking, I don't know right now that we can draw a conclusion that either of those things.
It's small enough numbers that it's hard to really do anything with the statistics so much. How many ICU beds do you have in your three counties there?
Castleview Hospital in Carbon County has 6, and Moab Regional Hospital in Grand County has 0.
Wow. Okay, so 6 total in your whole area. You're sending people up to the Wasatch Front for the most part if they get really sick.
Yeah, we do have to refer most of our serious cases.
Oh, gosh, and that's even harder for the families. If they can visit, they have to go that far. Hey, Braden, we are out of time. I really appreciate your perspective, and Godspeed to you with all the work that you're doing down there. I hope that things turn for the better.
Thank you, Matt.